Dr. Resmi S Kaimal, Consultant and Faculty, Department of Family Medicine, Luth Hospital, Kochi, Kerala. Nowadays, modern medicine is facing a lot of flack for its litigations. The main reason for this is lack of personalized care and humane touch of medicine, coupled with the rising cost of healthcare and the battery of unnecessary investigations. So, the relevance of family medicine comes in here. Primary healthcare can sort out around 90% of a person's problems, a person's and his family's health needs. So, if the primary healthcare is strengthened and there is an effective referral system, that itself can bring down the healthcare expenditure and also bring a humane touch to medicine. I would say that family medicine specialist is the best person qualified to give quality primary care. As of now in India, primary care is not integrated well into the system, and even the policy makers are giving more importance to develop the tertiary care centers. So, as a first contact doctor of a person and his family, the family physician will be best positioned to alter the primary health care system. So, primary health care provider should be the family physician, and that too a qualified family medicine specialist. In India, even the training programs in family medicine, there are very limited options. Actually, there is a DNB course run by the National Board, which is conducted in private hospitals, accredited hospitals. The another is an MD program running in only one government medical college in India. There are distance education courses like the MEd and DFM courses run by CMC Vellore. So, these are the options available for training in family medicine. As far as the scope of family medicine in India, that is the practice areas where a family medicine specialist can work in India, that is also limited as of now. Like a person can start his own clinic or a group practice, his own practice or a group practice, that is one option. The other option is staying in academic family medicine training institutes like the DNB institutions. We hope that in future this family medicine will be integrated into the undergraduate medical curriculum, and also there will be more and more MD family medicine courses starting, which can open a lot of scope for the family medicine trained qualified persons. Also, there have been talks and representations going on to the various state governments and also to the central government to integrate family medicine specialists into the government sector, because as I said earlier, the primary health centers or the community health centers where there will be a qualified family medicine specialist can bring down much of the burden of the government on developing the infrastructure as well as in the expenditure area. So, once this is integrated into the government sector, once a post is created for the family medicine specialist in the government sector, that is another option, that is another scope for family medicine in India. AFPI, or Academy of Family Physicians of India, is an organization of qualified family medicine specialists, that is trained family medicine specialists. So, it is a forum for primary care providers for improving their educational, that is academic area as well as the professional areas. So, AFPI has engaged in various activities like in relation to advocacy, education, or continuing the training, professional training, like improving the competency based training and all those things. AFPA has a website which is very popular among the DNB, that is the postgraduate residents as well as medical students as well as practicing family physicians, where they can share their experiences and they can know about the career options, they can have further guidance from the seniors and other experts in the field. Also, AFPA has a journal which is the first and only family medicine journal in India, which is a peer reviewed journal, that is the Journal of Family Medicine and Primary Care, JFMPC. So, which also highlights the research activities that AFPI is promoting. As part of these activities, strengthening the academic activities, we have been organizing the national conferences in family medicine and primary care since last 2 times, and it is the next time that we are hosting it in Kochi. There were 2 national conferences which were in Delhi. One was in 2013, that was the first national conference, and the second was in 2015. We had so many discussions with the health policy makers. There were policy discussions, advocacy sessions, also clinical topics. Even the National Board of Education was a partner. National Rural Health Mission was a partner. From these, we have moved so much forward as a young organization, or you can say an organization in its infancy. We have reached out to many people, all family physicians across the country through these last 2 conferences. And from these conferences, we have also known what is happening in other countries, like in Nepal or Sri Lanka or in the West or in Australia. Experts from these countries also had come for these conferences, and we had interacted with them, and that is helping us in improving what can be done in our country. The 3rd National Conference of Family Medicine and Primary Care, that is FMPC 2017, will be happening in Kochi, Kerala. The venue is IMA House, Kochi, and the dates are 28 and 29 of January 2017. It will be preceded by a postgraduate update, which will be on the 27th of January 2017. So, as you know, I have already said, there will be a postgraduate update as well as the main conference. The postgraduate update is mainly targeted for the postgraduate residents for their academic development and from the exam point of view and many other things. In the main conference, the highlights would be international faculty from across the globe coming in and sharing their experiences. There will be different panel discussions, symposia, plenary sessions, which will highlight where India stands in the global scenario and what could be done in the future. These are advocacy sessions, and there will be interesting clinical topics also, which can help the practitioners and the students update their knowledge. In this upcoming conference, our theme is Healthcare the Comprehensive Way, Family Medicine. As the theme says, family medicine stands for continuous, comprehensive care for the person and the family. So, this will be highlighted in the conference. The uniqueness of family medicine is what we are going to target in this conference.